All right, well, we will get started. Welcome everyone to, I think at this point, this is probably our 7th webinar that we've done. And I'm particularly excited for this webinar today because this is going to be an update on the state of the industry. Last time we provided you a state of the industry was back early in the year. It was around February. And I think we had kind of an idea of where things were at that point. Vaccines were out there. They were starting to proliferate in the population. Things seemed like they were going in a pretty good direction. And the start of the summer was good. And I think we all were feeling pretty confident. And then this Delta variant came and kind of hit us all upside the head. And now there's concern and there's questions about what the future will look like. There is still that pervasive uncertainty that exists. And we just thought that today would be a great opportunity to be able to update all of you on where we're at as an industry, the things that we're working on, but also to have a conversation with those of you that are on here about things that you have concerns about, maybe issues that we can address. So today is really just a circling back of what we talked about earlier in the year and just an update. And the good news is there's a lot of things to update you on. I think the biggest thing that's happened during the course of this year, and we're going to dive into this a little bit today, is we've really made some significant strides in our lobbying effort in Washington around the GIMS Act, and there seems to be a lot of positive movement associated with that. So we hope today to bring you more good news and positive news than bad news as a part of this discussion. In terms of some housekeeping notes, please use the Q&A feature to ask any questions that you might have. This is a Zoom webinar. We cannot see you, so raising your hand or waving your hand won't help you. Please use the Q&A feature. We'll do our best to get the questions as they occur, but certainly we're going to have some time left at the end. Those of you that are on there and think of some questions that you have throughout, we can hold them to the end and we can answer them at that time. So without any further ado, I'd like to introduce our two panelists today. Brian Reef is the CEO of PF Michigan Group. He is also the president of the MFCA. And Donald Jordan runs F45 fitness facilities. And he's also in his F45 shirt that makes his arms look considerably more jacked than Brian or I. So we're happy that that's the case. Brian and Donald, thank you for joining us.
Thanks, Michael. Appreciate you hosting this.
No problem.
Great to be here.
No problem. All right. So let's get right into this. And I think the first place to start, I think, is a very positive place. We, as the MFCA, have been focusing a lot on where we're going now. We had been very much backpedaling on defense, it seems, for the first half of the pandemic, just not trying to be shut down further, not trying to be in a position where we had greater capacity restrictions put on us. And now we're at the point where we're starting to hopefully see the light at the end of the tunnel, and we're starting to set a vision for the future. We've had many strategy sessions that have talked about this, and really what we've identified is the importance of our industry moving towards being a legitimate and essential stakeholder in the healthcare delivery system in this country, and why that's so important. So that's really where I first want to start. And Brian, I'll start with you and just ask the question, as we've came to this decision that this is the direction we're going and this is the vision we have for the MFCA, why is it so important for our industry to be considered part of the healthcare delivery system in the state?
I would say first and foremost, we are an integral part of people's health and wellness. And if you look at, and this is, I think, one of the things that the pandemic highlighted, massive health crisis that's going on in the United States today, and this was going on pre-pandemic, has been going on for decades. The big opportunity for us as an industry is really to start to get a foothold in participating in how do we address that health crisis, that public health crisis that has been going on. And we are much better today as a more organized industry in getting that message out there. I don't think that there's, the biggest franchise groups in the country are talking about it. Even the local gyms and fitness centers are talking about it. The media is starting to talk about it. and I know at some point we'll get to the question, how do we define success in achieving that goal of being considered part of that health delivery system. But in the meantime, I'm encouraged. I do think it's the silver lining in all of this, because the pandemic absolutely highlighted the fact that individuals with these comorbidities were much more at risk of bad outcomes when it came to COVID. And then you can layer in on top of that what the CDC has reported and what we're trying to get across, or what they're trying to get across, in that the people that are in better condition health-wise, it increases the efficacy of the vaccination. So there's all sorts of benefits. And I think it's, some of it is, we've been beating our head against a wall that exercise, physical activity is good for you for decades, but now is our time.
Yeah, really well said, Brian. And I think the one thing about COVID that is so striking is this is the first time in the history of chronic disease where a chronic disease can affect your health acutely. And what I mean by that is, if you have diabetes and you're diagnosed now, maybe in 30 years from now, you're going to have issue with neuropathy in your foot, or you're going to have retinal issues, or something bad's going to happen down the line. This is the first time where we've had an acute medical condition that was greatly exacerbated by chronic disease. And this is very, very much in people's consciousness. And you said it, everyone in our industry is talking about it, and we're starting to talk as one. In fact, one thing that a number of you may not be aware of is that IRSA at the national level has a medical and science advisory board of really the who's who in the fields of medicine and public health, advising at the national level. We are in the process at the state level of putting together a scientific and medical advisory board, because part of effectuating this change is making sure that we are having conversations with doctors and public health professionals. So we are moving in a good direction. And Donald, I'll throw it to you now as well. What's your perspective on this? Brian running massive Planet Fitness facilities, you running smaller studio-based F45, slightly different demographics that go to the two facilities, but still the same overarching goal. Why do you view this being so important for our industry?
Well, I want to comment on that specific point, but before that, I just want to emphasize something you said. It's the immediacy of the cause and effect between the comorbidities and COVID really brought it into stark contrast. But our country spends way too much money on healthcare costs. But if you look at where the costs are spent, it's in the chronic illness. And you can take a look at anybody and say, what are the indicators of poor longevity or health issues and these things? Most of them are chronic illness, and most of them can be addressed through walking, exercise, lifting weights, bone density. You have to do everything. And what we're seeing at F45, and it's not trying to promote the brand, but what I'm seeing in the boutique studios, our movements are really functional movements. So I take myself, I had my lower vertebrae were being sheared. And I was having back pain, and I went into the doctor and I asked him, is this reversible? And he said, yes. And I started, to be fair, I started with yoga and then added F45, and 22 years of back pain are gone. I have some of my trainers 4 months ago were making fun of me on my squats and the range of motion. And then the other day they said, wow, you're going really deep into your squats. And it really is, it's not just the problem is, it is the acuteness of the current situation of COVID and obesity and the other comorbidities that have brought it into stark contrast, but it's every little bit of it. It causes healthcare issues. Even a lack of range of motion causes cascading healthcare issues. And that's the problem is we are part of the medical delivery system. It's just we're not always perceived that way. And we really need to be. We're kind of the first line of defense before you get into chronic treatment, chronic care, and into the hospital.
Yeah, and let's put some context and some numbers around what you said in terms of healthcare costs in this country. The United States spends about 17.5% of its gross domestic product on healthcare costs. That is more than double any other advanced industrialized nation on the planet. And you might say, well, great, we're spending more money, so that means we're getting better care. And that's actually not the case. We aren't in the top 10 for life expectancy. We're like in like the middle for how long it takes to see a doctor. Donald, you mentioned costs and physical activity. The estimates by the CDC are approximately around $117 billion with a B can be attributed to lack of physical activity from a healthcare cost. And that's not even to speak of obesity and the other comorbidities. And this healthcare crisis looms as a much larger gorilla in the room compared to COVID. We have 500,000 people die every year in this country because of issues associated with poor diet, as an example.
Yeah.
When 500,000 people died from COVID, we had a national moment of mourning, and as well we should. And I'm stealing this from Dr. David Katz, so I want to attribute this to him. Now, Dr. Katz said to me on a podcast that we had a national moment of mourning, and we should have. But 500,000 people die every year from poor nutrition, and no one says anything about it.
Well, I mean,
Go ahead.
I didn't mean to cut you off, Brian, but if I'm correct, I looked it up before, we're 37th in the world in longevity behind Morocco. I'm sorry, but the way we eat and the way we have a lack of activity, and it's because of the wealth of the country. It's came about from a positive thing, but we have to be realistic. It's escalating healthcare costs, reducing longevity, and on top of that, it's lowering your quality of life. We can't treat fitness like an entertainment product anymore. It really does need to be treated and respected as a healthcare product.
Yeah, I was just going to say I love the phrase that Dr. Katz uses in that all of this is about adding years to life and life to years. Yeah. And it's such a simple phrase, but it really is. It has profound meaning when you think about the consequences that these individuals suffer when they have these very treatable, in most cases reversible, chronic diseases. So that, back to your original question, that is the mess. That's what we are here for. And I've said previously, the fitness industry has gone and continues to go through a renaissance. We see more concepts today than we have ever seen. And the choices that people have today run the gamut. And so I'm excited to be part of that, that health delivery system, but it is going to take a lot of work because, as you know, the paradox is what's killing us. We know medically, scientifically that we should be doing these things, but we don't do them. And it's going to require an effort on the part of everybody, a collective effort in the fitness and gym industry, which is, as I said before, and I apologize if I sound like a broken record, today we are working together as one here in Michigan at the national level. So there's absolutely a movement taking place in the gym and fitness industry, and I think it's important for us to continue to grow that.
And I think we also need to approach the legislature to really recognize that it is silly that the insurance companies won't pay $10 for a Planet Fitness membership, but they'll pay $300,000 for a heart transplant or a couple $1,000 every year for a supply of Lipitor. And that's what I just don't understand it. I think we are the first line of defense in preventative medicine.
Yeah, well, and make no mistake, going up against big pharma and these huge food companies is going to be no small task. But at the end of the day, I think that's something that every one of us as gym owners is prepared to do. I mean, we're in the business to inspire people to lead healthier lives. Taking pills and medications is not the way out of this.
Yeah, I agree.
And the opportunity here is so tremendous from both a public health perspective and from a business perspective. We are all very well aware that we as an industry right now work with a very small segment of the broader population. Maybe at best, we're working with 20% of the population at large. So by moving our way onto the healthcare continuum as a part of the healthcare delivery system, this starts to open us up to such a broader segment of the population. And there are some people that we realize that we will never get for many reasons. But even if we can get another 10 or 20% of the population to engage with, as Brian said, all these different fitness concepts that exist right now, because different strokes for different folks, right? My facility does something different than Donald's, does something different than Brian's, than everybody else's facilities that are on here. It's about finding a place in a community where somebody can connect and get healthier. The more we are unified in our message, the easier this will be to walk this path together. But to Brian's point, there's a lot of institutions and that are very, very stubborn that we're going up against. So we need to be unified. I do want to note here, Dr. Tony Moreno in the comments, Dr. Moreno, who's graciously agreed to be part of our Medical and Science Advisory Board, brings up that the United States is physically illiterate. And in one of our webinars earlier, we talked about this. And there are challenges with health and physical education in the schools. There are challenges with community recreations. And Tony brings up that, these could be potential customers, and there's great opportunity for, win-win collaborations. And Tony, to that, I will say, I was actually last Friday on a board meeting with the director of MParks, Clay Summers, with their public policy committee to see how MFCA and MParks can partner. But an area that I think is a very, very fertile area for us to explore is how gyms and fitness centers can partner with physical education in their community, because we are all well aware that physical education is being reduced and reduced and reduced more and more and more. And I think there's a tremendous opportunity for us there. So those partnerships and those collaborations are going to be key to us being legitimized as a healthcare delivery stakeholder.
I couldn't agree more. I think Dr. Moreno he hit the nail on the head. We are a physically illiterate country, and until we decide that we want to be physically literate, we're going to keep repeating the same things that we've been doing. So I think that's absolutely a very valid point. And how do we, as the Michigan Fitness Club Association, work to accomplish some of the goals in getting to that level of physical literacy, and absolutely in the school systems.
And I think on some level, we need strong advocates. Tony, I know you're an amazingly strong advocate, but everyone who's on this call and everyone who will listen to this, you have relationships in your communities. And I think that outreach work and those grassroots conversations can make such a significant difference, and probably a broader topic for another time. But I think that those are things that we're very keenly interested in exploring, because this is going to be both a top-down, we certainly need the public policy to support us, but also going to be a bottom-up grassroots approach in order for this to be successful. Donald, I look like I was cutting you off.
No, actually, I was going to say there is one wild card in this whole scheme, not to make this too conversational, but the idea that our phones and our watches may start tattling on us and affect our insurance rates, our insurance coverage, and we may have a technologically driven change to how the fitness industry is deemed, where if, and I can tell you a specific example, one automotive company here in Southeast Michigan had someone wear a tracker, and if you didn't get 10,000 steps in a day, they were raising the insurance rates. And so it is starting to hit, and I think that also could wind up being a driver in how we're perceived and how the fitness industry, how people are pushed toward it. But that said, it has to be fun, it has to be voluntary to be sustainable. Otherwise, it's just not sustainable.
Yeah, the stick method can be effective at driving some behavior change, but hopefully we can use the carrot more often than the stick.
Well, we've gotten people into the gym, and I'm sure Planet Fitness and you've done the same thing, that have not walked into a gym in decades. And, the first week, 2 weeks, month is fairly challenging. They tough through it. Once they're 2 months into it, their life has changed dramatically. I mean, we have one gentleman who actually got a tattoo of our logo on his leg because we changed his life significantly. And so that's where, when they see the results, and you get in, you're walking on a treadmill, or you're doing functional movements, or your body's changing and improving, those are the types of things that make it sustainable.
Yeah, and there's a lot to unpack with this, but by no stretch of the imagination in a conversation like this can we tell you how we're going to necessarily effectuate this. And I think in part because we don't know all of the answers yet, but we do know that if we're focused on one goal and we're speaking with one voice at the state and at the national level, that can make a substantive difference. Brian, you kind of said it earlier, so I'll throw it back to you for this. But I don't know if it's even a fair question for me to ask you, what does success look like for this? Because I don't know if anyone knows that answer, but maybe the question is, if this is where we are going, what do we need to do to start moving in this direction?
Well, I think that what we've talked about with the MFCA is taking this multi-pronged approach in terms of our strategy. I would say one of the things that we have looked at and need to focus on is lowering the obesity rate, the adult obesity rate to start here in the state of Michigan, but teen and childhood obesity rates in Michigan are some of the worst in the country as well. So one of the things, we need to set a target out there. We need to, and I think it's something that is readily visible to everybody. Pre-pandemic, Michigan had adult obesity rates exceeding 36%. It hasn't been updated, but suffice it to say that number is easily in the high 40% range amongst adults. And we know what happened with kids and stay at home for an entire year in terms of learning. Largely sitting on the couch and playing video games. So there was not a whole lot of activity. So we have an opportunity there where one of the things we've identified is we are going to attack that. We are going to and set realistic goals over the next 3, 5, 10 years to get Michigan off of that list, for example. So legislative outreach, which we've talked about, and continuing as far as our state level advocacy for the entire gym and fitness industry, and making sure that we're working collectively with our elected officials, with public health officials, to make sure that we're well positioned to deliver on some of those commitments that we want to deliver on. And I'm certainly happy to share with this group those efforts. And I don't know if we want to talk now about what's going on with the GYMS Act at the federal level, and then similar efforts that are being made by the MFCA to advocate for targeted relief at the state level.
Yeah, well, let's pin that for 1 second, because I want to get Donald's thought on this. And I agree. Setting a tangible goal around the obesity rate in the state that's something that we can see and we can feel and we can actually affect. Donald, throwing it to you, what do you think we need to do to start moving in this direction?
I would say that education is key. People just, and I would include myself in this, that people just need to be educated on what is it a healthy person is like, what is the ideal, how do you get there, and what are the ramifications for getting there and not getting there. And I know this sounds silly, but my daughter in high school was one time measuring a serving of cereal. I don't think there's a human being alive who puts out just a single serving of cereal when you see how small the quantity is. But we need that kind of literacy because the impact is dramatic. We used to call it adult onset diabetes, and now they're seeing children 8 years old having, quote unquote, adult onset diabetes. the effects on that person's lifestyle and their healthcare costs is dramatic. And it's not just a healthcare cost. That person will tend to have a lower quality of life. And those are things we have to address to help people live happier, healthier lives. And again, to hit that phrase again, adding life to years and years to life. So it's that phrase. And I think we do need to educate in the schools, because I know I didn't get it. And hopefully I actually learned a little bit from my daughter. And I hope that the schools teach it more to the kids, because the kids can teach the parents. And I'm an example of that.
And Mike, I would add to that one more thing. And I know it sounds a little cliche, but a healthy gym and fitness industry will translate to a healthy population. I have no doubt about that.
You know, Brian, I will touch on that for a second. You're absolutely correct. And that's one of the things I've really appreciated about the MFCA. We're not really competitors, all the gyms here. You know, the friendliest place to go into is Planet Fitness. It's really welcoming. And so it gets people into that lifestyle. And it's you know, whatever direction they want to go in, big box studio, rowing, cycling, whatever it is, it starts that lifestyle adaptation. I think that the industry has to survive. I believe we've lost 27% of the gyms in Michigan so far, 392 gyms or 82 gyms, if I remember correctly. And that is not good. You know, that's not just defaulted loans and, you know, defaulted mortgages and everything else and lifestyle upheaval. I can tell you for a fact, and in fact, you probably know this also, Mike, given where your gym's located. A few gyms in Plymouth closed and had a cascading effect on the people who used to go to those gyms. It really impacted their lifestyle, their health, and that's not good. We need the gyms to survive.
Yeah, you said it. Both of you guys nailed it. Is that we know, like, first and foremost, I think we've learned this internally as the MFCA, and it's been I'm very grateful for the relationships I have with people in the MFCA, and I think the people that are on this call it'll resonate with them. My competitor isn't it isn't Brian. That's not my enemy. My enemy is the remote control, the couch, McDonald's, Burger King. That's the common enemy that we're all fighting here. And you said it, 27% of gyms and fitness centers closed in Michigan. We were third highest in the entire country for closure rate. And we all know, as gym and fitness center owners, people will only drive so far for fitness. There has to be a convenience factor, right? A barrier of being too far away. We've done research at AFS, and I'm sure Brian and Donald, you guys have data too. It's about like 9 to 10 minutes that people will drive to go to a gym or a fitness center. And it's this kind of the same thing with physical therapy. Like, if anyone ever wondered why there's so many physical therapy clinics, people only will drive so far. Just imagine what would happen to the orthopedic health of our state if 27% of physical therapy clinics closed. You know, that would be a crisis. And so not only do we have to survive, do we have to stop the closure, but we need to actually reopen some of these facilities that have closed. So I think that is such an excellent point. And there's a lot going on. James asked a question: what, if anything, is the MFCA doing to work with insurance companies in the state to try to affect change that will they will cover gym memberships and things like that? James, that provides us a good segue to start to talk about some of the legislation that's going on, because there is some legislation at the federal level called the FIT Act, which I think is probably the gateway to what you're talking about. So I'm going to pin your question, and I'm going to throw it back to Brian to touch a little bit on some of the lobbying effort that's happening both at the federal and the state level. And Brian, let's start with the federal level with the GYMS Act and talk a little bit about that.
Sure. So the latest on the GYMS Act is there's on the House side, they have 155 co-sponsors that have signed up to support the what is today a $30 billion package targeted for gyms and fitness centers. It was mirrored off of the theater relief package that was approved earlier this year in April, and similar legislation that targeted relief that was approved for restaurants and hospitality. So there's no real departure. It was approved for these other industries and very much mirrors how that relief would be doled out if it's approved. On the Senate side, there are currently 17 co-sponsors. The numbers are looking good. There is an ongoing effort to continue to push that, and I'm encouraged that and at various points I feel like it's hard to think that once the American Rescue Plan was passed, the $1.9 trillion back in April, that we lost our opportunity. And I can tell you today, we do not feel, I don't feel that way. I'm encouraged. It's still a long way to go, but I am encouraged. At the state level, there are smaller packages or legislation that is being run through. Personal property tax relief. There's sales and use tax relief on PPE. But the significant legislation that we're attempting to work on, a proposal that we're attempting to work on, is a $90 million package. We crafted it around rent relief because that seems to be the biggest single expense that all of us incur as gym and fitness center owners. And to qualify for that relief, you can qualify it through other measures as well, but to push that through at the state level, because there is money, there is COVID-related money that is coming into the state that the legislature has every right to earmark for specific uses. And if it was COVID related and you have an industry like ours, we were shut down in Michigan as long as any other state except for North Carolina, New Jersey, and New York. When we reopened, we had some of the most severe restrictions in place with masks required and occupancy limits. So we lived through a period of a year, 18 months, where we suffered more than largely every state in the U.S. California might be the exception, but we have a story to tell, and we have a basis for asking for that relief. So we feel like we've got support on the Senate and on the House side in Lansing. Right now, the legislature is in recess. They haven't finalized the budget. What we're being told at the moment is that this would be part of the supplemental. So nothing will happen through the standard budget process. But once the budget is approved, they will go into supplemental and talk about additional proposals that are being talked about out there. And I can tell you, we are working tirelessly with our lobbyists and the Michigan Fitness Club Association, reaching out to senators and representatives to tell our story and to get support for that targeted relief.
Yeah, and I wouldn't understate how much the Michigan Fitness Club Association has done the heavy lifting for the industry in Michigan. Even at the national level, the Community Gyms Coalition has several times enlisted us. We've secured support from senators and congressmen here. And the Gyms Act is not just some pie in the sky dream. Right now, it looks like it's going to go after the August recess. When they're back in session, it looks like it's going to go into the Small Business Committee and could be approved in reconciliation. So there's a real chance for this getting passed. There is one small gap, and that's for gyms opened that weren't opened in 2019, that opened just in the beginning of 2020, like my gym. But they're actually even trying to address that. So hopefully it can get relief for all the gyms that have been impacted by this crisis.
And to be clear in terms of what the Gyms Act is, for the vast majority of people that are listening, it is a grant of up to 45% of 2019 revenue. It is not a small chunk of money. Now, is it actually going to turn out to come out of the legislation that's passed like that? things remain to be seen. But to the point of tireless effort, I know myself, Brian, Donald, and a number of other people on the MFCA board, we were actually sending emails to the aides for people on the small business committee in the Senate. So this has been something we have been pushing very, very hard for. And I know it's easy to be cynical around anything associated with politics, but I think we all feel a sense of collective optimism. And if nothing else, this has acted to really legitimize our industry in the eyes of lawmakers. Like we finally have a seat at the table. We finally have a voice in the room, and that's going to lead to positive things. And I want to get back to James's question around what are we doing to engage insurance companies? Well, obviously this is a massive, massive challenge, but the gateway to this is something called the FIT Act, PHIT. And this is a federal legislation that we're looking to get passed. And URSA is really lobbying hard for this to allow people to use their FSA accounts, their flex spending accounts associated with healthcare for gym and fitness center memberships. Currently, that is not something that's permissible, but that is something we are lobbying for. That is the first step. That is the gateway to the opportunity to get insurance reimbursements of things of that nature. So that is a very, very steep hill to climb, as you could imagine. And there's a lot of complications to that type of an infrastructure as we get involved with it. But we are starting to move in that direction. Likely something that we as the MFCA will start to look at as we convene our Medical and Science Advisory Board. I actually have a conversation with somebody that I know who works for Priority Health in wellness, who may be coming on as a part of our Medical and Science Advisory Board that can help us navigate that. But that is a longer term goal. I think in the shorter term, the FIT Act could become a reality, which would at least grease the skids to us moving towards more insurance reimbursement.
Can I touch on 2 points with that? The first is we are really early in the game. I remember when we were first forming the Michigan Fitness Club Association, we reached out to some lobbyists and politicians in Lansing, and the exact reaction we got, I think word for word, was, it's about time. You guys literally have no voice in Lansing. You had no presence. The hotel industry did, the hospitality industry did, the restaurant industry did. We were the only industry that I know of that was non-existent. And so we've been in, as an association just over a year. We really banded together and worked together. So it's early on, but that said, I think even our mission, which is we're part of the healthcare delivery system, is, a step in that lobbying direction. And I think to combat the big pharma and the food industry, we can hopefully enlist the insurance companies because they're the ones paying the bills. And if we can enlist them in our lobbying effort, hopefully we can make some traction in Lansing.
Yeah, it is a process, and it requires help. It does. This is something that none of us can do on our own, no matter what resources we have. And so I'll throw this question out to both of you guys. I know you both will have thoughts on this, so feel free, whoever wants to answer first. But for people that want to help in our lobbying effort, what would you say to those people that are listening? What can they do?
Well, I'm sorry, I didn't mean to jump in, Brian, but having had friends and children who've been in congressional staff and Senate staff, including one Senate chief of staff, they respond to numbers. The squeaky wheel gets the grease. That's the blunt end of it. If it's one call, they're basically told, be polite, say yes, hang up the phone and do nothing. If you're getting 1,000 emails and phone calls flooding in, they react to that. It's just a numbers game. And, I'll be honest with you, I God bless URSA. They've made it easy in their one-click programs to contact the Senate, contact Congress. I think that's a big factor that people can do. And I'll be honest with you, the one self-serving thing I will say, join the Michigan Fitness Club Association. We have full-time lobbyists in Lansing on retainer, and they're lobbying on our behalf. They're trying to push these things forward. And so, the people on this call and the other members, we're doing the heavy lifting, but we need help and we need more people to join the MFCA.
Yeah, well said. I think we're today we're an all volunteer association. We will likely be that for the foreseeable future. But I think as we start to get traction with our membership and get more members, we will be able to utilize some of those additional resources. The platform that Donald referenced that Ursa uses, Quorum, is unbelievable, and it's not outrageously expensive, but we couldn't contemplate that today. But I think we all on the MFCA envision a day where you can replicate those things at the state level, and where today it's truly a grassroots effort, and it's picking up the phone, it's typing out an email. At some point, one of the things that we would like to accomplish is getting to a point where we have the money and ultimately the resources to do those things at the state level. Can you imagine if it was that simple? We had every senator and every representative in Lansing that was identified in a system like that. And we had a targeted proposal that we wanted to go after, and we had a form letter that would be customizable, but in very short order that you could send out. It would be a very powerful way for us to accomplish a lot of these things as it relates to, ultimately, our mission is to protect the industry and to foster growth in the industry. So there's really no better way to do that than for all of us to band together and be able to utilize different resources like that.
Yeah, you guys both nailed it. I think it is very much a grassroots effort, and the more people we have in the grass with us right now, the more effective that this could be. And we have set some lofty goals. We have a lofty vision for what we want to accomplish. And the great thing about our industry is there's a lot of passion behind it. As you listen to Brian, you listen to Donald talk, you hear how passionate they are about this. And that's not the exception in our industry. That's the rule. We're all very passionate about it. But now our passion needs to be focused. And again, we encourage reaching out to your representatives, joining the MFCA. Donald, you said it earlier. You think that sometimes you can't make a difference, but what the MFCA has showed me is that a very, very small group of people working in a very hard, focused fashion can actually make a difference. And the more people we have, the more critical mass we have, the more of a difference we can make. So, please, consider doing the things that help us to thrive as an organization, because that's just going to help our industry go in a positive direction.
Yeah, and speaking of getting people to move, it's such a satisfying thing to get an email from a Senate staffer or a congressional staffer that says, "Yes, we got it. They've co-sponsored. Leave us alone," because that means that they've got the message and they're getting inundated. And our last effort was very targeted, very personal, and we got very personalized responses back. And I see nothing but support from the industry, but this is an industry that largely until recently has been quiet. And so we need to show the importance of this industry to the American people and to the country.
Yeah, awesome. Well, we've got about 50 minutes left, and I want to switch gears here to things that might be a little bit more operationally relevant to some of the people that are on the call, and just kind of have a discussion around what are we seeing in our businesses right now? What are we concerned about? What's happening? And I think to ask the focus question initially, Delta variant is here. There's a lot of uncertainty. What are you guys seeing in your business? How are you handling it? Brian, we'll start with you. How is Delta impacting Planet Fitness right now? And what are you doing with your team and your members to ensure that the impact is minimal?
So great question. I'm going to start with simply, we're following state and local guidance, which we have done from day one. As it relates specifically to masks, requiring masks, not requiring masks, vaccinations, not requiring, we're following that state and local guidance. in terms of what we're seeing in our business today, we were seeing good positive growth once all of the restrictions were lifted in late June. And by the way, having better than normal summer months, which are typically slower months for us in terms of joins and cancellations. August has been a good month overall for our business, and as we're looking at usage, we do see more and more people coming back into the gym, feeling more comfortable. We don't track it necessarily as a statistic. So this is a little anecdotal. Because the Delta variant is being so widely reported, and it is here in Michigan, it's at the forefront in the school systems today. I think that there's concern out there, and likewise, we are concerned, but we are still we've taken what we learned during. And I know we're not out of the pandemic, but we're taking a lot of what we developed with our reopening guidelines, the cleaning and sanitizing protocols that we put into place, and just the touchless measures that we put into place. A lot of those still exist in our business. A lot of those still exist in all of our businesses, not just Planet Fitness. So I think we're very comfortable with people coming into our gyms today, despite what we're seeing in terms of the Delta variant. And I think the one thing that we've learned in the last 18 months is that it's very difficult to forecast in the middle of a pandemic. And so even with little, and I'm not saying little, I'm not undermining the Delta variant, but even when something like this happens, it makes it much more difficult to forecast what things are going to look like for the rest of this year. I would be foolish to say I'm confident one way or the other. I think once the kids go back to school, we're going to get a pretty good indication of whether this variant is going to spread significantly. The same applies to, as the weather cools off, more and more people are going to go indoors. So that will also, I don't present an issue. It's there. So as I said before, it really boils down to following state and local guidance. And then really just a common sense approach to, a lot of the things that we took out of the pandemic in terms of protecting our staff and our members are still in place today.
Yeah, great. Donald, how about you?
Very much the same. We're keeping the same type of cleaning protocols in place. Hand sanitizer stations everywhere. We have our air scrubbers. All of those things are running. When we can, even we're keeping the doors open just to keep airflow going in. So we're following the same safety protocols. We are seeing, though, that it goes through phases. In January, which would have been our peak season, although I was a new gym, so we missed the first January. The numbers just weren't there. And when I say weren't there, I mean there was nothing coming in, even though we were marketing ourselves heavily. And we've seen things steadily come back. In a way, I don't want this to sound insensitive or inappropriate, but we kind of lucked out because the Delta variant hit, I think, when the Michigan population just had enough of being in lockdown, or some version of lockdown, because we haven't seen numbers fall off. We're seeing them, people still coming back, still wanting to be back into the gym. And it's a little bit different, a boutique studio versus a large floor space like Planet Fitness. And yet we're still seeing people come back. So I think in terms of consumer behavior, I'm still encouraged that things are coming back. That said, we checked the other day, I think I had about 100 people still paused, which for a studio like us is massive. Like that's a massive number of paused members. And so, I'm optimistic that means the future could be better, but we are seeing people come back. And I just think we kind of lucked out in terms of the timing when Delta hit. That said, look, the truth is it is going to increase numbers. Michigan's going to get hit, and numbers will probably level off going forward. The other statistic I did see that just the other day, I think this morning, is that we're exceeding 1 million vaccines a day again in the US. So clearly people are concerned, they're getting vaccinated. Hopefully that means we won't have a big resurgence in the fall.
Yeah, and I'll just add to really echo what both Brian and Donald said, very similar. One of my facilities is in Ann Arbor, Michigan. And, I have a facility in Ann Arbor, facility in Rochester, and facility in Plymouth, Michigan. And our Ann Arbor facility throughout the pandemic was definitely had the most conservative response in terms of masking and distancing and wanting to be incredibly cautious. And looking at our utilization trends and our enrollments and our cancellations from Ann Arbor, we're not seeing anything that's strikingly different from what Brian and Donald just said, and very similar to our Rochester and our Plymouth locations. And I think, Donald, you're right. I think people are just so intolerant of further restrictions right now that seems worse in many people's minds. This is not right or wrong, but it just seems to be what the sentiment is. That's worse in people's minds than the Delta variant at this point. And I think it is a positive thing for now. Brian, you said it. There's still going to be uncertainty going into the fall. Kids go back to school, winter gets here. We're far from out of this at this point, but I'd say that it seems like all of our trends, as well as other people I've talked to, seems to suggest that this is not impacting us to the degree I think we all would have thought of as the Delta variant started to ramp up. And I think on balance, that is a good thing, but also what Brian and Donald said, and I will echo, all of those mitigation procedures that we learned about early in the pandemic, we're still keeping in place. And those are probably going to be just general best practices going forward. So I think the positive thing is that we all seem to be seeing a degree of growth that I think we wouldn't have expected to see given all of the coverage of the Delta variant. But we need to be focused. We need to be unified as an industry. We need to be paying attention to what's going on, because as we've all learned during the course of this past 18 months, things can change on a dime, and we do need to be prepared to respond when and if that happens.
I think that highlights the mental wellness piece of this, and to Donald's point, I think that people do recognize, and it is being reported in the media, that this pandemic has absolutely taken a toll on everybody mentally. And the one thing you can do, one thing you have control over to combat that is exercise and physical activity. We know, that's been scientifically and medically studied for decades. The benefits of physical activity and exercise on your mental well-being. So I think, and that again, part of we touched on Dr. Moreno and becoming more physically literate. We've talked about just the benefits directly of physical exercise to combat obesity and all of the related diseases, chronic diseases that are preventable and in some cases reversible, and then the mental piece of that as well. So I would say, and Michael, you did a podcast on that topic alone. I would suggest anybody that is here to go back and watch that again. I've watched it several times, and every time I watch it, I take something new away from it. But at the end of the day, it's, all of these things are working together. And I think that's where the MFCA will continue to message that out there, that is, back to your original question, why we feel like we are an integral part of the healthcare delivery system in this country.
Yeah, outstanding. And I'll make sure I link up. Thank you for the plug on the podcast. I'll make sure I link that up when we send out the email after this with the video and any other resources. Well, we've got about 4 minutes left, and we always like to be respectful of everyone's time. If there's any questions that anybody has that you would like to drop in the chat, we're happy to take a couple of minutes to answer those as you're considering questions to potentially ask. I will say that we are here for you as your state trade association, and we definitely want to hear from you. I see Monica Carson, who's on the call or on the meeting, that we had a great chat last Friday, and it was just really great to connect with her and have a good conversation with a fellow gym and fitness owner in the state. We're here for you guys. Feel free to reach out. My email will come by way of the follow-up email from this webinar. You can always reach out via our website, but the way we get through this is if we are unified and we are speaking as one voice and we are supporting each other, and that can't happen if we don't connect. So please feel free to reach out to any of us. If you have any pressing concerns, we're more than happy to have the conversation. I don't see any questions coming in the Q&A. So Donald, Brian, any parting thoughts for everyone?
I'll just say that this association has just wonderful people part of it. And I'm not just saying that lightly. The heavy lifting that everybody that's on the board of the association does is phenomenal. And it's never lost on me, and I'm really impressed with it.
I would echo that. I am grateful to be a part of it, to have met some really incredible business owners who I can now say are friends. And I think that's, I've said before, I'm a little embarrassed to think that, we've been in the business for over 13 years and never really thought about the significance of a trade association, because, we are competitors, but we're really not. We're, we will all benefit, and the fitness industry and in general here in Michigan will benefit by banding together. So I'm grateful that we started this, and I'm really encouraged with what we've identified as our strategy going forward, and I am looking forward in the coming years of being able to have to affect change as it relates to what is a very significant issue today. So thank you, Mike.
Yep. Gentlemen, thank you very much. All of our attendees, thank you very much. Please be on the lookout for next month's webinar. As always, we try to do these towards the end of the month on a Wednesday or Thursday at around 1 p.m. If you have any suggestions for webinar topics, always happy to take those. Thank you everyone for joining us, and please stay in touch.
Thank you.
Thank you, guys.
Brian, I'm going to stop recording.